welcome. Today we will talk about hypertension. So our outline is how hypertension occurs in simple explanation, what can cause hypertension, ranges of blood pressure, signs and symptoms of hypertension, how to manage hypertension, how to prevent hypertension, and how to check blood pressure. So we must know what is hypertension. It is a chronic disease and it is affecting the vessels. So we can define the hypertension. It is high blood pressure by blood circulation, that it is force against the wall of the arteries. And nowadays we can see not only elderly they are having hypertension, even young people also they are suffering from the same disease, that it is hypertension. So we must know how to prevent getting hypertension, so it will be having a good life and a healthy and longer life. How hypertension occurs? We will explain it simply. You can see the blood vessels. This is the normal blood vessels. There is no any abnormalities. The blood can be move smoothly in the blood vessels. But when there is something to block the blood vessels, the blood will be hardly going to the blood vessels and it will be against the wall of the blood vessels. So we know now how hypertension occurs in simple explanation. In the picture we saw that there is block of the blood vessels wall by a plaque or cholesterol. This will force the blood to go through the blood vessels, and also the elderly they will be suffering that blood vessels will be reducing its elasticity. So the elasticity with some occlusion in the blood vessels, it will cause the blood vessels to be high, that the blood moving very difficultly in the blood vessels. This will be causing hypertension. What can cause hypertension? First, elderly aging. They will be having reduced the elasticity, plus maybe there is some occlusion in the blood vessels. Sedentary lifestyle, there is no exercise, eating unhealthy food, maybe the not moving, or many other reasons. Eating on unhealthy diet, overweight or obesity, smoking, increased salt in the diet, not doing exercise, and even stress. This all will cause hypertension. We want to know what is the normal range and what is the abnormal range of the blood pressure. So below 90/40, the patient will go to hypotension, that the blood pressure will be low. 100/60 to 130/80, this is the typical and ideal blood pressure. Above 140/90, we can consider this patient hypertensive, and he must be taken care and he must observe his blood pressure. Signs and symptoms of hypertension. If you are having high BP, what you will feel? So there is many signs and symptoms you will feel if your BP is high. First, feeling of severe headache, and you cannot tolerate this headache. You can feel nausea and vomiting, feeling numbness and cold in some or all extremities, feeling chest tightness and pain, feeling of dry mouth, and feeling of sweating, tiredness, and fatigue. So this is the sign and symptoms. Now we want to know how to manage hypertension. If your blood pressure is high, you must do these things. Recheck your blood pressure every week regularly uh, to prevent the increase of blood pressure. Take your medication as the doctor prescribed for you. Regular follow-up with your healthcare professional to identify the improvement in your health status. Reduce oil and salt in your diet. Do exercise daily like walking, jogging, and swimming. Eat a healthy diet and follow a strict diet plan. Drink plenty of water like normal adult. We need 8 cups of water daily. Reduce the stress in your life. Now we want to prevent hypertension. So what we will do, we must change our lifestyle and be more active. Eating healthy diet, reduce weight, reduce salt and oil in the diet, stop smoking, do exercise daily, try to make meditation and yoga. That one, it will reduce your stress level. Check your BP regularly, like every 1 week, if the patient is having hypertension, and if not, the patient can check it once or twice monthly. Now we will see how we can check our blood pressure manually. We want sphygmomanometer, stethoscope, and gloves if needed. If the patient is too much sweating or there is some infection, we can use the gloves. Today I will show you how to do checking the blood pressure at home. So I will check you and I will teach you how to do blood pressure manually. So you need the sphygmomanometer. This sphygmomanometer, it is contain the BP cuff, the stethoscope. I have already ready-made the stethoscope. It is connected in the right place, and this is the watch. We will see the systolic and diastolic blood pressure, and we have the bulb, and there is bulb here to open or to close when you want to inflate and to deflate the air to the cuff. So now we will start. First we must wash our hands, and if the patient is having some problem like sweating, so you can wear your gloves. Now we will start doing the checking the blood pressure manually. So now we will check the blood pressure manually. First we will check the radial. We will check where is the brachial artery. We will feel, and above of brachial artery 2 inches we will put the BP cuff. Because the stethoscope is attached with the BP cuff, so it is directly on the in the pulse that we identified. Now we will check the estimated systolic blood pressure by identifying the radial pulse. The radial pulse, it will be in the thumb side. You can check the radial pulse by putting 2 fingers on one side, and you will feel there is a pulse. So now I feel the pulse. First, we want to estimate the systolic blood pressure. We will see, this is the watch. We will estimate what is the systolic blood pressure by seeing the watch. So now I will inflate the BP cuff, and I will be having my finger on the radial pulse until the pulse will be disappeared. So I will inflate now, slowly. So the pulse disappeared on 110. Now we want to check the blood pressure of the patient. So we estimated that the systolic blood pressure is 110. We must increase 30. So it will be 140. We will inflate the BP cuff until 140, and we will hear the sounds of the blood by stethoscope. So now we can check. Until 140 we will increase, and slowly we will reduce. So started the blood from 130. Now disappeared on 70. Now we know that his blood pressure is 130/70. If you want to know the normal range of the blood pressure, if the patient is having high blood pressure or low blood pressure, please go to my blog page, Health and Wellness, and for each one who is having high blood pressure and low blood pressure, what is the management for that? So thank you very much for your attention. See you in another video. See you in another video for the management of the health of the patients. Thank you very much. In conclusion, really hypertension, it is a chronic disease and it can affect the person's life. So we must prevent or care of the disease. So prevention is better than cure. So you can live your life healthy and live life happy and remove all stresses that can affect negatively. Most diseases comes because of the stress. Try to reduce your stress by doing exercises, meditation, yoga. All these things can reduce your stress. Be happy and encourage yourself to do better in your life.